right, good evening, everyone. Thank you for joining us. We'd love to hear where everyone is joining from. I think we're hitting multiple time zones here from our panelists. We have Kentucky, Colorado. I'm calling in from Germany, and then California as well. So, we appreciate everyone taking their evenings to learn a bit more. I'd like to introduce myself. My name is Eric Mendonca. I'm the Director of Business Development at Fluxergy. And Fluxergy is a point of care company that is dedicated to building tools for improving equine care. So right now we have a salmonella assay, developing a few respiratory assays. And the goal is to really develop some panels as well that can help veterinarians get their results faster in the clinic. But a big part of that is, really being dedicated to education. I think with new tools, it's really about learning how to use these tools and really learning about why we use these tools. And, that's why we're really excited about today's content. Today we're gonna talk a little bit about salmonella, and I think we have two of the best people to do so in terms of their experience. The title is "My Horse, Hospital, or Stable Has Salmonella, Now What?" We're joined by Dr. Josie Traub-Dargits, who has an esteemed career in the equine industry. She's a professor emeritus from Colorado State, has worked with the USDA APHIS, and again, has really set the guidelines for many things in terms of what we do in terms of equine medicine. Also we have Dr. Nathan Slovis, who we're really excited about the content that he's going to provide. He's going to be speaking for about 30 minutes on what he does, or his practice does, in terms of monitoring for salmonella. Currently, he's the director of the McGee Medical and Critical Care Center at the Haggard Equine Medical Institute. He has several publications with regards to infectious disease and really what to do. And I think this webinar we were excited to support because it's really about the practical approaches in terms of what we do in private practice. So again, thank you everyone for joining today. This is worth one CE credit, so please reach out to us and we're happy to get that credit over to you. In addition, please put your questions in the Q&A or in the chat, and we'll go ahead and get to those after we get through the content from Dr. Traub-Dargits and Dr. Slovis. So I will hand it off to you, Nathan. Thank you again for joining us today. We really appreciate your time and excited to hear your content.
No, my pleasure. Thank you for inviting me here. I always enjoy being with Josie Traub-Dargits, a good friend of mine. So it's always good for us to join up and team up for this. So salmonella, what, doc? That seems to be a big thing. Doc, I got salmonella. Now what am I going to do? What I'm going to do is about the first 20 minutes or so of this talk, just get everybody up to speed. So we're on the same playing field in regards to some of the knowledge on salmonella, how long these horses shed for, what we found out with some research we've done at our clinic, along with Colorado and Georgia, looking at fecal shedding of salmonella. This is some hand hygiene practices. And after that, let's ask some questions. I can tell you some experiences we do here in regards to biosecurity, and what would be something that you may want to do on your facility, either be at a barn or, being at a hospital. So here you go, doc. Horse comes in, profuse watery diarrhea. Of course, one of the differentials is going to be salmonella. Especially in our area, the Midwest, we see quite a bit. I'm not talking hundreds of cases, but we'll see about 20 cases or so a year that would come through our clinic in our area. So one thing you want to be thinking about is the biosecurity aspect when it comes to salmonella or any infectious diseases. It comes to the PR nightmare, the press nightmare. Back in the day when Colorado State was having some issues, that was before you had internet sort of spreading the knowledge and the news and go like wildfire. So that's one kind of stigma you want to try to prevent. Is, infectious diseases will come into your hospital. The whole idea is to prevent it from spreading. So when we think about biosecurity, it's a challenge. Our goals is to minimize infectious diseases in our patients. And you want to have buy-in from everybody. Everybody has to buy in regards to in the facility to implement infectious disease protocols. But then the question is, how do we best implement what we know? How do we best learn from our mistakes? Well, I learned from my mistake right here. This picture illustrates a mistake I had. These are my two boys. And I learned never tell them a lie to get them onto a ride. They asked me, Dad, does this ride go down, a flume? Is it going to go fast? And I go, no, it's a nice, simple water ride. Everything's fine. Well, you see, Dad's having a great time here. These kids are scared to death. And ever since this time when they were 6 and 7, they don't trust Dad anymore. I'm the liar, this, that, and the other. So learn from your mistakes. And I learned I should never lie to my kids or tell a little fib when they were young. And then the best thing is how to keep on learning. These diseases, there's new protocols in regards to biosecurity over the years that have been implemented and what we can learn from and how to best implement these new strategies. But so perception of our veterinarians is that the perception is we're the infectious disease preventionists. We know the knowledge of the pathophysiology of disease, so we must know infectious disease control, epidemiology, etc. Clients are going to come to us to get this information because in the community, we're the leadership, we're the educators, we're the mentors. However, you may have only had 10 minutes of your entire veterinary curriculum may have been talking about infectious disease or biosecurity. And you may not have all this knowledge, but the community is going to think you do. And granted, it's easy to look up, but just be prepared. Even if you don't have any interest in infectious diseases, your clients are going to look onto you as if you are the expert. And so it is good to have some knowledge in regards to infectious diseases, especially some of these that can spread on the farm or your facility, because we are the people that the people are going to lean on. So when we're looking at it, I have a lot of people go, I don't have problems on my facility. I don't need an infectious disease prevention program. I've never had a problem. I hope I don't have a problem. Well, hope is not in the vocabulary of infectious disease prevention. I hope I can stay on this bull for 8 seconds. These riders don't hope. They're determined to get it done. Unfortunately, a lot of times when there's a problem, it's usually an outbreak that occurs that triggers a response for evaluation. Or maybe there's a threat of a disease because your neighbor has some issues and you're worried about it spreading to your farm, or another veterinary clinic in the area may be having problems and you're worried. And now all of a sudden you want to have an evaluation. Now all of a sudden you want to implement protocols. Ideally, you want to perform before an outbreak so you can see what the normal circumstances are and the normal day-to-day operations are of the facility so you know how to implement different biosecurity strategies. Because the impact of salmonellosis, just in one hospital in the Midwest, they saw a financial cost of $300,000. They had morbidity, mortality, veterinary education, hurt because the students couldn't learn because you couldn't get patients coming in, legal issues. You're talking about hospital closures, Michigan, everybody, even private practices have closed down. Blue Ridge, Equine, in Virginia, just one of several hospitals, private practice hospitals had to close down. And that is dramatic effects on the economics. So what do we know about salmonella? We know about salmonella, depending on the study, 7 to 15% of normal horses may shed salmonella. It doesn't mean they're going to continuously shed this, you'll be able to detect it if you do some random testing. What we do know is 1,000 colonies will grow to greater than 1 billion colonies in 6 to 8 hours and 100 degrees Fahrenheit in environment. One fly can carry 6,000 salmonella, a study showed. Now, one fly, is it 6,000 colonies of salmonella? Is that enough to cause disease in an animal? We don't know. Maggots in salmonella positive manure remain salmonella positive for life, after 4 weeks, depending on what kind of fly you're talking about. So now flies can carry 6,000 salmonella. Maggots that may be in the salmon, in the manure, will be exposed, and they're for life. Mice that eat manure can maintain salmonella positive. We've isolated salmonella from mice at our facility. We had some increased incidence of salmonella going through our facility, which I felt like was nosocomial. We started looking at some of the mice, and we literally took the feces from the mice that we caught, and we found salmonella. So we know this. So good rodent control. Dogs and cats, could they be at risk? It's a big debate. Should you have a cat in your barn or your hospital facility? We do. We have not detected in the cats and dogs. When I was at Davis, they detected in some of the ducks that used to come into the aisleways of Davis, veterinary school. So again, maybe some birds can do it. Be fomites. We know geese can. So an asymptomatic horse may shed 100 to 200 colonies per gram of feces. That's not much. We just talked about a fly could carry 6,000 in one study. But a symptomatic carrier can carry 10 billion colonies per gram of feces. And that's the ones we're worried about. The more the symptomatic carrier, the spread this disease, it's going to be much higher numbers. Now, when you look at neonates, they're predisposed to bacteremia, septicemia, delayed closure of the GI tract, immature immune response. Neonates are particularly susceptible to salmonella. Animals on antibiotics, we're going to talk about that a little further on, about antibiotics on antibiotics. Animals that are stressed, shipping, new facility, etc. These animals may be more predisposed to salmonella. So Helen Aceto, one of the big questions is, once an animal is exposed to salmonella, how long will it take before they shed it, before they get fevers, before they have diarrhea? And that is a tough question to ask and to even answer. We can ask it, it's tougher to answer it, because it all depends on the animal, what their stress is, what's their age, what's their microbiota, the normal microbiota in their intestinal tract, because most adult horses won't have problems. So once exposed to salmonella, how long will it take until the animal starts to shed it? Most hospitals say, and including us at times, say, if your animal comes into our hospital and if they start shedding salmonella after 3 days of being in the hospital, it may be a nosocomial. So Helen Aceto just looked at a variety of journals, looked at 43 studies, and they looked at animals that they actually infected these animals with salmonella. Mostly cattle and sheep in the study, but there were 4 studies in horses. And here are some of the endpoints of these. So endpoints, we looked at onset of fecal shedding, pyrexia, and diarrhea. Now, granted, this study back then just looked at cultures only. They didn't look at molecular testing. It could be even more sensitive, potentially. So at this time, just looking at cultures only, what they noticed is that these animals, when they were exposed and given salmonella, you saw fecal shedding within 1.5 to 2.5 days after inoculation. So they can start shedding it quite fast. Pyrexia, the average was about 2.5 days. So they'll tend to shed it before they have the pyrexia times. And then diarrhea can be anywhere from roughly 2 to 3 days. But here's the kicker. These animals were healthy animals, don't forget. These weren't sick animals. And so they couldn't really they couldn't identify risk factors, look at statistical significance or positive predictive values in regards to the age of the animal in these studies, the log of the dose. It was all over the place. So we can't tell you what dose. Was it 6,000 colony forming units, or was it 10,000? Or was it 100,000? It varied. So just some interesting information here. Just talks about that how long does it take to fecal shed? Most hospitals, as I said, you think of 3 days, greater than 3 days, maybe it's nosocomial. Some of these horses can be shedding in 2 days after exposure. So maybe the 3 days, saying if your animal starts shedding salmonella at 3 days after being in the hospital is nosocomial. That could be correct, but it could be even shorter than that duration. So it's fecal oral route of infection. Young animals are more susceptible. Why? Because we're talking about the microflora, less established host defenses. We talked about that. They can migrate through the intestinal tract, stimulate local inflammation, local enterotoxins, cytotoxins. They can travel through the lymphatics. Next thing you know, they hit into the joint or into your growth plate, like you see right here on this young animal. Once that happens, then we have some significant issues going on here. So, what are you going to do? Well, of course, you want to isolate the animal. You want to decrease exposure to pregnant and young animals. The thing is, zoonosis, especially immunocompromised people, it tends to be a low risk for adult animals as long as you use proper biosecurity. So the big question is, leaving the hospital setting, what are the factors associated with equine shedding of multi-drug resistant Salmonella enterica and its impact of health outcomes? In our neck of the woods, we'll see multi-drug resistant Salmonella. So clients get nervous because clients nowadays are very educated in our area. When your animal has Salmonella and they're about to be discharged, they'll ask, is it resistant Salmonella or is it all susceptible? Well, the question was, people had a stigma that if you had multi-drug resistant, that was a worse bug to have, and it will cause more disease in your horse. And therefore, it will cause increased risk of spreading it on the farm. So clients were very nervous about taking these multi-drug resistant Salmonella horses home. So we did a study with Paul Morley and Brandy Burgess. At that time, Brandy was at Colorado. Paul was at Colorado at the time also. And here are the facts that we found. We followed these animals going home. We followed their herd mates. I'm going to read this to you. Salmonella did not decrease long-term survival or increase the recurrence of colic or abnormal feces in hospitalized horses, nor increase the risk for hospitalization or abnormal feces in their stablemates. Now here's the question. Our farms were well educated, so they employed rigorous personal and environmental hygiene. So this is just in central Kentucky. We did not see the problem as long as they followed our protocols for hygiene. So the stigma sort of just disappeared. So people were not as reluctant. They used to keep these horses at our clinic for 20, 30 days, trying to get 3 negative Salmonella cultures. That's a whole different ball question. How many negative Salmonella cultures do you need before you think your animal or you feel safe with your animal joining the rest of your herd? Is it 3? Is it 5? I'm ready to have a debate on that. I think it's interesting information. When I was taught 5. 5 consecutive Salmonella cultures, not 5 in a row, but 5 spread over time. We can discuss that a little more. But hand hygiene is very important. We talk about the rigorous aspect of Central Kentucky with hand hygiene. Now, I got this from Josie. Great studies. It's kind of a fun study she did with vet students. And these are people, when they arrive to the vet hospital, they put their hands in just buffered saline in a Ziploc bag, practically. Put their hands in there. These are vet students that come from home. Here's what they arrive with. They do a physical exam on a horse. And then they wash their hands with ivory soap. Now, what do we know with COVID? Most people don't wash their hands long enough. It's quick. You got to sing happy birthday. The goal was to reduce the load of bacteria on your hands to what you arrived at the clinic with, so to speak. Have a reduction in logs. And so you didn't really see a significant reduction here. But if you use the Purell hand wipes, the goal is not to have your hands sterile. You don't want a sterile environment on your hands. You want to reduce the bioburden. Before exam, after Purell. The plates just shows you. Hand hygiene is so important, but How many of us have good hand hygiene? This is a farm that is having an outbreak of salmonella in their youngsters. I mean, where's their hand soap? I mean, I got a paper towels here. It's on a paper towel hanger. You have some dish soap here, but it's not really hand soap. I look at the restroom. I don't see any soap. Just where's their soap? You got to walk outside to get the soap, in the main sink. Just think about hand hygiene. Ideally, you want hand hygiene in an area. You want dishwashing soap for dishes. You want hand soap, antibacterial, ideally, soap in a wall-mounted soap dispenser so it can't walk away. You want a paper towel dispenser that maybe is protected, that can break off. When you pull the paper towels, they break off individually so you don't contaminate the whole roll of paper towels. When you have a wet hand and you touch those paper towels, everything's going to wick right through them. Those paper towels are paper thin. But you may say, golly, Nathan, I don't have these type of sinks in my barn. I got a barn, a tobacco barn. I don't really have any sinks. I got a hydrant in the middle of the barn to do, a water hydrant to water the horses. Well, no worry. There's portable hand washing stations. This is one. I was down in Florida and we were with people were swimming with the dolphins at this one facility. And then you had to wash your hands and do everything before you hang out with the dolphins. And they had it sitting right here. These are portable hand washing stations. If you have a problem and you need one of these, in our local area, it was costing $80 a month to have this. And if you're going through an outbreak, for a couple months, renting one of these, it's dirt cheap. If you don't have the hand wiping facility on your facility, things you think about. How about this one? Hey, Doc, I got another salmonella outbreak. Where's their hand soap? Where's their towel dispenser? They touch these towels with wet hands, you're gonna wick right through. You can see how disorganized they are. I mean, this is supposed to be their hospital treatment room in one of their facilities, stables, and they got a de-icer, they got a drill, they got some foam gun for insulation, instant installation foam. How about this one? I don't see any hand soap. You guys see anything here? And the craziest thing is, this is actually not a salmonella, this is Clostridium difficile outbreak. They were so proud because every foal, when it's born, they give them a probiotic. But they put it in a syringe and they give their foal a probiotic. And then they put the syringes in the sink and it's like musical chairs. Does the foal get the same syringe the next day that it had? No, it gets its neighbor's syringe. But now, now we have diarrhea. So now they're giving metronidazole, other antibiotics in these syringes. They're giving to the foal. They may be handling the foal's rear end, touching the syringe with their dirty, disgusting hands. They may have diarrhea. They put it in the sink, claim they rinse it, and now the diarrhea syringe that's been used for a foal that had diarrhea may be going to a newborn foal for his probiotic. Does that make sense? No. So look at hand hygiene. Walk through the facility of these facilities. Lysol, that's a great surface disinfectant. Is that supposed to be used for foot baths? Not the last time I saw. And this is during a equine herpes virus outbreak. So approach the facility like an exam. If you go there to approach it, people say, I'm going to have foot dips in front of every dip pans in front of every stall. You may be on the phone consulting with this client. They talk about foot baths, but this foot bath has more manure in there than actually disinfectant. Then they have these booties to help with an outbreak. This farm had salmonella. An outbreak was with booties, but they kept reusing them. They would touch the booties when they put them on with their bare hands. They would infect their hands. Finally, I said, guess what? No dip pans, no booties, because they didn't know how to follow it. And if they don't know how to follow it, it's worthless. It's more of a fomite. And lo and behold, we went more of hand hygiene. And this farm really reduced the incidence of salmonella. You can do foot baths. There's different products you can use, 4 ounces of bleach to a gallon of water. The problem is, as soon as that disinfectant gets soiled, the bleach, it gets inactivated over time. You got to change that bucket at least 3 or 4 times a day. You can use Tektrol, which is a phenol, not as environmentally friendly. Some of your protocols, your local state protocols may not allow you to use phenols depending on your city ordinances. Rescue is a hydrogen peroxide based product. It's very safe, environmentally friendly, costs a little more. You got to use a little more of it, but it's quite a good product as well. So do you wear these disposable booties, or do you want to do muck boots? You got to maybe be able to be sure they utilize them, use those booties properly. And again, if a mare, it seems like these mares, and John Madigan did a great study on this, looking at these mares that may have negative salmonella cultures for 30 days. And as soon as they go into stage 2 labor, lo and behold, they start shedding salmonella. They're not sick, but they can expose it to their foals. And therefore now our protocols have been for the last last 23 years was to wipe the udders with udder wipes. What kind of udder wipes you use? Usually used for cattle. It's easy. So in conclusion, keep this, clean the stall last, separate stall, instruments, manure, maybe a compost pile. What's the big question? Is your goal 5 negative cultures? Or do you don't want to spend the money? You're like, I don't want to spend that money on cultures. Well, we've learned, and Brandy Burgess looked at this. Our clinic has looked at it here, as well as Brad Smith from UC Davis. At about 1 month, 65% of the horses were culture negative, or 5 culture negatives. In 2 months, 95%. We've discharged them from our hospital. We've had no issues discharging positive animals from the hospital. There's a Morse Foundation grant that we got with Brandy Burgess and myself of how long will my horse shed salmonella? And we just discussed that. It could be up to 60 days, but usually majority of them by 60 days, majority of them would be negative. Humans, a big problem with humans with salmonella. Horse trailers. People get these shipping companies. They use a variety of different shipping companies. We tested horse trailers. 1 out of 10, we found salmonella in. So how do you isolate? There's culture, there's PCR testing. PCR is faster, very sensitive. Problem is you don't get an antibiogram, but if you get a PCR positive, most labs will take that sample and will culture it to get you an antibiogram. Disinfect hand traffic. Again, wipe down your hand traffic areas where you can use rescue wipes, Clorox wipes, just something that can wipe off the surface area with hand traffic when you have problems. Because we'll see it going crazy in regards to stall pins, stall doors. Now, vaccine is probably the best way to prevent any sort of infectious disease outbreak, being it herpes, flu, what have you. There is a vaccine that we do have here at our clinic. We do have okay by our state veterinarian that we are allowed to use it within our state. And if you get approval from your state veterinarian, then we can ship this vaccine to you all. It has a conditional license in Kentucky. We got to get a conditional license every year. And it's a Bactrim vaccine. And of course, how are you going to talk to your clients about this? Your horse has salmonella, but is not sick. Just explain, don't scare them that it has salmonella. Just educate them. And that's the biggest thing, because people get the stigma like, oh my gosh, I'm not taking the salmonella home. You're going to cause an outbreak. No, but it's not sick. Here are some things you can do. You can get this handout sheet on our website under handout sheets, and you can just copy, put your farm name, put your clinic name on it. Whatever you wish. But in conclusion, this is a brief example of some of these ideas for salmonella. And I will stop sharing my screen. Did you open up some dialogue? Josie, I think you're muted.
I think you're on mute, Josie. Yeah.
Yep, I got it. Okay. So thanks, Nathan. That was really a good overview. So just a couple questions I had. Your cleaning and disinfection protocol, I believe you have a video on your website that describes it, but people might want to know in general what you do, and whether that's just in the isolation area or is every stall cleaned and disinfected between each patient, and what kind of surveillance you do on your hospital population for salmonella.
Yeah, great question. So in regards to disinfecting, every stall gets disinfected and cleaned. So every stall, and I think Harry just posted something on the website. Feel free, or excuse me, in the chat, but every stall gets disinfected. We've changed products. We used to go to a phenol product for many, many years. But since then, we went to a more environmentally friendly product. It's a little more money. It probably costs our hospital afterwards. We do so much, another $15,000 a year to use it, but we feel like it's better for the environment. And I think we've had decreased issues of nosocomials, but that is Rescue. It's a hydrogen peroxide based product. Rescue. Phenols are still good, don't get me wrong. They're much cheaper, but for the environment and just for safety of humans, the Rescue is a safer aspect. And then for our hospital population, since we have an increased risk of animals coming in with salmonella, and we have such a young population of horses coming to our facility, the foals, yearlings, a lot of training, horses in training. Every animal that comes to our facility gets tested for salmonella in the medicine facility. If they're up at surgery and they're getting a simple surgical procedure, arthroscopy, they don't get tested unless they happen to be at the clinic for more than 24 hours and they get tested. And we don't hide it. We're very transparent. The clients will see the charge on their invoice. They'll ask, and we say it's part of surveillance. That's what we do. I can hide the cost, into a hospitalization rate, but guess what? I'm going to show you. Everybody's bought into this. Your neighbor, the horse next to you, is getting the same thing. We help protect the horse population, and we'll charge them. So that's what we end up doing. And
so you take a sample when they come in, and then do you continue to sample them while they're in the hospital?
Excellent question. So it depends. We have different biosecurity levels. It depends what they're coming in for. If it's a colic, even if they went to surgery or no surgery, they get 3 cultures, 1 a day. If it's an eye, an eye case, 1 culture. If it's a respiratory case, 1 culture when they arrive. And then we do it weekly. So they're there for, if they arrive, we do it every Monday. So if they arrive on Sunday and it's a respiratory case and we get 1 sample, well, guess what? The Monday they get another sample because it's just protocol. We'll do it every Monday, every horse in the facility. And that again gets charged to the client. So it depends on the cases. Diarrhea cases, 3 in a row. Then after that, as needed by the veterinarian. And here we'll do PCR sampling of them because it's quick. And I can also pull the samples. We'll pull 10 horses together. If you have a low incidence, we'll pull 10 horses together. And what I mean is we'll take each individual swab. You have to put in selenite broth because it has to enrich. You got to let it grow. You want to kill some of the organisms. It's a selective media. You want the salmonella to grow. So enrich it for 24 hours. And I may have 10, test tubes, with swabs in it and selenite broth. And then I'll take 250 micromils of the broth, put into another tube, and I'll mix 10 horses of that together, mix it up, and we'll put it onto our PCR and we'll see. If it's negative, then great. And again, we had Nicola Perstilla from UC Davis. He validated it for him too, because we gave a bunch of salmonella horses and he validated that it was okay to pull up to 10 horses. And so it depends. Again, we're in a higher risk area. If you're not, then maybe you only want to do animals that have a fever of unknown origin, a low white blood cell count, post-colic surgeries. And you can pull those if you want. If you have several post-ops, you want to pull them together because you have a low incidence, it'll save you money.
And do you do environmental testing for salmonella to determine the effectiveness of your cleaning and disinfection?
Absolutely. So what we'll do is we'll do environmentals. And what we do, some people like to use Q-tips, swabs. We want something more surface area. And we actually learned this from Colorado, and Josie and their whole team there. We'll take Swiffers. So just an electrostatic cloth, not one that's scented. We call it Swiffer here in America. And say, what I'll do is I'm not just going to use one Swiffer. Let's pretend I have a knockdown stall. And let's say I also have, the patient stall, and I may have, the treatment area or a catheter cart. And I want to do all three. I'm not going to take that one swab or Swiffer and Swiffer all three areas, because you're going to spread disease if one of them is positive. What you do, you cut that Swiffer in thirds and do your stall. I'm not doing the floors and the stalls. I've never done the floors. I have a protocol that will do the shoulder area height, and I'll go all four walls. I'll do the door handles. I do the pin. I do the feed buckets. But we won't do the floors. I've not had a problem. I haven't had a positive floor, at least in our environment, ours, because we have our floors are non-porous and there's a single mat. So I don't have areas with tongues and grooves or I hope I don't, that disease can get underneath the mat. This is our environment, and I haven't had a problem of a stall that was hot for salmonella, that I missed something because I didn't do the floors. This is what we do here. And then we'll do it. And then we'll hand those Swiffers in. They'll put it in one cylindrical tube, all three samples. Doesn't mean, they're going to give you three different cultures. They put all three samples together, the Swiffers, in a cylindrical tube, put selenite broth in there, let it sit, and then they'll take the selenite broth and put on the PCR. And I just get 3 cultures for the price of one PCR. So, and if you want to, you can cut them in fifths and do 5 areas if you want. I haven't done more than that, but some things to think about.
And when you get positive PCRs in your lab, you do culture for salmonella and do the antibiogram, but do you also send those for serotyping?
Correct. Yep. We do send them to serotyping to NVLS, and they'll end up serotyping it for us. And then I get at the end of the year, I look at the spit out and see what we have. And there's some serotypes that don't even have a name yet. There's some serotypes that have some cool names like banana. And there's some that have typhimurium, agona, keep going on and on and on. But yeah, we'll definitely serotype. It's just good for the veterinary community as a whole to keep track of these, as you know more than anybody, Josie. But it just, we want to learn from each other and help educate.
I think the serotyping historically has also helped with knowing whether you're seeing something in your hospital predominating and therefore maybe have a nosocomial issue. And the antibiogram can change over time on those salmonella, potentially with hospital exposure. So I don't think you can always just use the antibiogram to say whether you're seeing a similar salmonella across cases.
No, and I'll be the first to admit, we were not doing environmental salmonella. I thought, give me a break. Why do we got to do environmental salmonella? I mean, we tested the animals, but I thought, that's crazy. That happens elsewhere. Then we started looking. I went, oh my God, look what I'm missing. This catheter card had salmonella on it. And I'm like, my gosh. And then we type it out. It's the same as the horse that had it, the week before. And I'm like, oh my gosh, we're not having an outbreak, but this could have led to an outbreak. And, I was amazed. It took us until 2005. Once University of Pennsylvania had their outbreak happen, then I realized, oh boy, I wonder if we should test our facility. And then I realized, boy, that opened up a can of worms. But it educated us, and we did a much better job. And I think in the long run, it helped us become better in biosecurity.
So we'd encourage those that are on the webinar, if you have comments or questions, to put them in the chat or the Q&A so that we can address them. I guess another thing on the flooring, I think that's been a challenge for some clinics to find flooring they feel like they can clean and disinfect effectively. You said you do have a mat in the stalls, and what type of mat is it and how is it sealed down?
Yeah, okay, yeah, so ours, we have polyurethane around the edges. So we have a one-piece mat, and there's companies that could do it. You could buy them. I mean, they weigh like 800, pounds. Like we had to get a forklift to get these mats. So different ways you can get the one-piece mats. Now I forgot where we bought them from. I was just going to tell you, but I forgot now. The company, it's here in Kentucky. There's also a company called Abacus Flooring that University of Pennsylvania introduced us to. And it's pretty much just like poured rubber. So you almost look like you're pouring concrete, but it's rubber. And then they have 5 layers of polyurethane that they put on there. And that's a one piece. And there's no sealing around the edges. It's all sealed. That's one. And there's several other companies out there too. So that's what we end up having on our facility.
So there are a few questions in the chat.
I can go ahead and ask a couple of those. And the first one, maybe this is to both of you. This is from Jess Folks. Have you published or looked at any studies that look at shedding over time?
Yeah, Brandy Burgess. In 2018, she presented at ACVI. Maybe it was 2000. Yeah, it's probably 2018. ACVIM. She presented a paper that we had Morris Animal Foundation got a grant, and she may have it out there. It'll talk about. Let me show. I don't have it on me. I'm just trying to find the paper. And she may have it published already. I probably should know this. But look at Brandy Burgess, Burgess. And the study is, forgive me, I'm gonna see if I can find it for you real fast. You'll have one, I don't have it right here. We have the one with Brandy Burgess and Paul Morley and myself, factors associated with equine shedding of multi-drug resistant Salmonella enterica and its impact on health outcomes. I believe that was in JVIM. It was published in Journal of Veterinary Internal Medicine. And then Brandy has another one out that recently was done that she followed horses that they were positive from all over the country, how long they shed for. And try to look that up. And forgive me, I don't have it on this computer. But there is published data out there, absolutely, in the last couple of years.
So maybe you could share that after the webinar, that reference. Harry could send it out to those that are participating.
Absolutely.
Yeah, likewise, those videos that you made, Nathan, are great on the Haggard website. And I think that Josie found, we were looking at them the other day. A lot of good content there. And so I have a question.
Sure.
I think that's come up a bit in conversations that I've had with clinicians when we have our Salmonella platform. They're starting to do Salmonella testing in-house. Questions about litigation come up, not only with regards to our results that we have, but just in general. It seems like, with nosocomial infection, it's just a question there. So have you participated in any cases with Salmonella that involve litigation? And, was there any question from kind of the legal side about, the biosecurity plan and the biosurveillance plan? Because that's, as someone that's maybe lived in it, it'd be great to get, both of your opinions on that.
Yeah, I've been asked to, but I don't do it. I won't go against another veterinary practice or another veterinarian. But I've had, at least close to a dozen that they would call me up and say, "Hey, my horse had Salmonella, got at the clinic. We need an expert witness." And so I feel for these clinics that and I don't know all the specifics because I just say no. But I know several clinics close to home have had some litigation occur because they question biosecurity. So yeah, that's a real thing, and lawyers are know that. I mean, there's some lawyers that they are known to do that. So I don't know about Josie if she's had any experience.
Well, I haven't gotten sued for a hospital acquired infection. One thing that we did do is put a statement in our admission form that horses that are in the hospital are at higher risk for infection and injury, and that we take precautions to try to reduce the risk of those. But it doesn't eliminate the risk completely. And we also have in the statement that there was a surveillance program in place for certain infectious diseases, and their horse, even if it wasn't clinical, may end up being detected to have salmonella shedding. So when we called them and said, your orthopedic case that has no GI disease came up positive and it's going to have to move to isolation, and it comes at an increased cost, they're at least signed the form that they understood that, that could happen. I don't think having a nosocomial infection in and of itself, as long as there's precautions being taken and on the front end, you're doing surveillance to try to detect that, in and of itself is malpractice. I think ignoring you have a problem could certainly be concerning. So I think it all depends. And I guess there really isn't that I'm aware of, and maybe Nathan knows, but I don't know that there's a detailed standard related to that specifically.
Yeah.
So I think it's about informed consent and the fact that you're taking precautions, and when you identify a problem, you communicate about the problem to your clients and take action to mitigate the problem.
Absolutely.
Yeah, it seems like maybe there's some paperwork that it's good to have and get that in order in terms of just having a biosecurity plan, or, if you're going to be a lab and having validation data for laboratory tests or QC procedures. I think that's all important, it seems like. Yeah, let me see if we have a few other questions here. That's great information, I think.
There was a question about your thoughts on environmental stall testing after horses have been cleared to leave. I think maybe you addressed that, Nathan, that you do testing. And I know when Dr. Morley was in charge of the biosecurity at CSU, they did testing on stalls where we had known positives. And we had some situations where they came back positive, despite being cleaned and disinfected. And I have to say, most of ours were the floors, as opposed to the walls, let's say. And we had to go in and re-clean and potentially even do more disinfection to try to resolve the problem. And, certainly if there were defects in the mats, deal with the mats being potentially an area we couldn't completely disinfect.
Yeah, and then it's a very good point, because some of these disinfectants, like the phenols, have you ever used a phenol before? It gets a film, and over time, you can end up getting a biofilm on the stall, and we can get salmonella. And you're like, well, I'm cleaning it with phenols, but over time, it says on the product, you got to use a product. And we used biogel at the time, and it was almost like an acidic cleaner that would just wipe that biofilm, wipe the residue of the Tektral. And you think, well, if I got residue of Tektral, it's great, but over years upon years, it's like having glaze on your donut. You got to get that off. And then once we did that, oh my God, the stall is now negative. And it was very frustrating. And we didn't learn that until we actually talked to the company. And they said, oh yeah, you got to use this biogel. You can, over time, if you don't clean it properly, you can get a biofilm. Now, rescue don't get that, the hydrogen peroxide. And that's part of the reason why we also switched also.
Yeah. And we found, at least in our foot bath study, that quaternary ammonia that we were using on the stalls when we had it in the foot baths weren't significantly reducing fecal bacteria, but the Virkon, which was an accelerated peroxygen, did a really good job reducing it. So we switched disinfectants in the foot baths, foot mats, based on studies that we did.
It's interesting because the foot mats, we did that one year, and I got rid of every one of them. We spent a ton for 50 of them, because we started seeing an increase in nosocomial salmonella. I thought, this is crazy. But these foot mats, they'll have pieces of straw hay, and it just gets stuck there. And then our people would have to start cleaning them out. Then some of those foot mats, there's like a little kid, you get a mat, and then you get something you put your mat in that it keeps it moist. It's like a protecting layer. Forgive me, it's almost, I'm not explaining it too well. We went back and we started culturing these bottom of these mats, and we started getting salmonella in that. And I thought, forget it, I'm getting rid of it. We went back to dip pans. And people are like, well, what do we use for dip pans? I just go to the restaurant business nearby that they sell all these things, just what the busboys carry around, what they put all their dishes in that big pan.
Mm-hmm.
And that's what we use. Because some people get these cheap at Walmart pans that break, or just get one of these nice industrial busboy deals. And you can put your whole foot in there, and it's great. So there's some things to think about if you're looking for industrial stuff nowadays. Maybe there's certain companies it's really easy to find dip pans, but back in the days, 20 plus years ago, that's what we were using.
Well, I think your point's well taken that they have to be kept clean, whichever system you use.
Yeah. Very good point. I'm not downplaying mats. Just for us, it didn't work out.
I have another question. So I think, again, dealing with clinics and, maybe understanding, hey, do you test, do you not test? Why don't you test? Maybe as an internal medicine specialist that has now developed a pretty significant biosecurity protocol for Haggard, how do you justify, investing into a broader biosecurity plan to the partners, let's say? Maybe if you're the internal medicine specialist at the clinic, or maybe just someone that is concerned and wants to do a bit more. Where would maybe both of you start with that?
Yeah, I think a lot of it is, we're all in this together, sort of one health, and you want to do what's right for the horse, right for your community. And the last thing I want to do, be it strangles or be it whatever, is send something out into the community that I wish I never did. And part of the biosecurity will help protect not only the farms, but also our hospital. My hospital's our patient. It's a patient. And I don't want to bring something out to the farm. So what we usually do with the partnership, they didn't have any problem because they knew what the incident was in this area at the time. And so they'd always ask, before they took an animal home, do you have any other salmonellas that were popped up positive around this horse? They would ask that. And what am I going to say? No, I don't know. I don't test. Then they're like, golly, are you really the state-of-the-art clinic we want you for our area? So we'll end up testing. I think it's just, I don't think some areas, if you don't see an increased incidence, I don't think you got to test every horse that comes in. We do, because we have an increased incidence, but maybe the colics, every colic, maybe the animals that ended up, low white blood cell count, fevers of unknown origin with a low white blood cell count, put them higher alert. Maybe they don't have diarrhea yet, but those animals could be at more at risk. And a lot of people say, well, I never detect it. Well, half the reason you don't detect it because you probably haven't tested for it. So you'd be amazed, because trust me, I was one of those people. I was like, forget about environmental. We'll never find it. That's a joke. We do great stall cleaning, but trust me, we found it. And it scared us. And we mitigated it. And so, and there's nothing wrong. If you find it in a patient, it's not your fault. It's like reading the newspaper. I'm giving you bad news. I didn't create the news. I'm reading it to you. These animals came to the clinic. It's going to happen. Our goal is to prevent it from spreading to another patient. But they're going to come to the clinic. They're going to come, and it will be yours or anybody's, any sort of it. So this is just one way of mitigating it, and you can feel good. And charge the client, and we charge them.
I think a challenge that I've seen is getting people to recognize the importance of the infection control plan, and that it isn't just developed to make things harder to do. There's nothing about biosecurity protocols that makes people's job in the hospital easier. And it takes time and it takes effort. And I think the other thing, and I've heard this term used, is the doctor's shield. So if the lead clinician doesn't wash their hands after handling a patient, then none of the techs or the students or interns or house officers think it's important. So I think there has to be not only buy-in, but compliance at every level with whatever protocols you put in place. And one of the things I'd compliment Paul Morley on is he really developed our standard operating procedure from scratch when he came in after our salmonella outbreak. And he did a lot of studies to prove the things that he wanted people to do were effective. So the foot bath studies, the hand hygiene studies, the stall sampling studies, to say it's important that we do these things. And he really, emphasized education, making people understand the importance and that there was science behind it. But then eventually there could be consequences if people didn't comply with the protocols. And one thing I guess that was interesting to me is if you never have to refill the soap dispensers or the alcohol hand hygiene dispensers, people aren't using them. So it's a pretty easy way to look at whether people are doing some of the things you want them to do without standing there 24 hours a day.
Absolutely.
Yeah, I think that sounds like a good place to wrap things up with. Make sure we're looking at the soap dispensers. That's
and the alcohol hygiene dispensers.
Yeah. But yeah, I think really a lot of great knowledge here today, and we're going to email everybody regarding the CE credit. Put some links in there from regarding the journal publication and some more materials. Yeah, please share within your practices as well. I think information is power, and we're going to keep pushing out these webinars, with your fellow colleagues, because I think it's really important just to educate what we're all experiencing. Yeah, so we can get a bit better. So
Absolutely.
all right, everybody. Yeah, thank you so much again. And thank you, Nathan. Thank you, Josie. Thanks again for your time.
Absolutely. Thanks.